So one of the common presentations to the ED is the swollen bump on the neck, or the lymph node. And lots of people approach this problem differently in their clinical practice. Well, point of care ultrasound can help you out a little bit as you're trying to determine whether or not you're dealing with an abscess or a necrotic lymph node, or if you're just dealing with a reactive lymph node. Now, of course, if someone's had a swollen lymph node and fevers and it's been months, totally different ballgame. So everything has to be taken as a piece of the puzzle and within its clinical context. But for a child who's had a swollen lymph node for 2 or 3 days, it's big, it's red, maybe it's even been as long as 5 days, and you're looking and you're really wondering, is there something there? What we see is a spectrum of transition from being a reactive node to being a necrotic or abscess node. So how does that look? So you start off with this elliptical lymph node that has normal architecture and it's got flow in the center, and as the disease progresses and as it becomes necrotic and turns into an abscess, it becomes round, it loses that architecture, and the flow moves from the center to the periphery. So when you look at these lymph nodes, you're going to find that they're somewhere on that spectrum, and that can help guide you in your prognosis and treatment. Now, do we have empirical evidence to tell us how that should change our management yet? Absolutely not. Do we know if this puts these children at higher risk to develop abscesses? We don't know that either. But we do know that there is this change that takes place as a lymph node goes from being reactive or potentially infected to being necrotic and abscessed. And you can identify that with point of care ultrasound.